Hi, I'm Dr. Sarah Hurvitz from the University of California, Los Angeles, and I am a breast medical oncologist. There are two well-established ways to test for HER2. The most common way is to take a thin slice or section of the tumor and stain it for the HER2 protein. This stain is called immunohistochemistry, or IHC. The pathologist will look at how many cells are stained within the tumor and will assess how intense the staining is and assign it a score. 0 or 1 plus means there's no overexpression of the HER2 protein, and we would call that HER2 negative. 2 plus is when there is an intermediate amount of the protein staining, and that is borderline or indeterminate. That pathologist can't make a call on whether it's HER2 negative or HER2 positive. And then 3 plus is when there is dramatic overexpression. The staining is intense, and a high proportion of the cells in a given sample have intense staining for HER2 protein. The other way to test is by a test called FISH, F-I-S-H, or fluorescent in situ hybridization. This way, this assay, as we call it, is actually looking at the number of HER2 genes in a given cancer cell. If there are more than 2, then that's not normal, because every cell in our body should have 2 copies of every gene. So if there are more than two times more than the value that they should have, that is called a HER2 amplified cancer cell, meaning there's extra copies of the HER2 gene. Immunohistochemistry is a very common way of looking at HER2 overexpression. It's done by all labs that do breast cancer testing, and it is fairly standardized now and is pretty much consistent with the way that FISH testing reads out. However, if a score comes back as 2 plus or borderline by IHC, it must be tested by FISH in order to decide whether or not it's truly HER2 amplified. There are unusual cases where the FISH is borderline, and so pathologists have a set of guidelines that help them understand how to retest and interpret those unusual borderline cases.